guys, it's me, Adam Deshawn, with another video. So I know you guys are like, where have you been? Um, to be honest with you guys, I have been just so uninspired. I have not really known what to talk about. But I was just kind of sitting thinking today, like, yes, I need to make a video before the year is out. And what can I discuss? So I'm going to talk about something that has kind of been on my mind here lately, and it's called and it's gonna be like compassion in nursing. I think nursing has lost its compassion. I don't know if it is the nurses that we're graduating. I don't know if we're just starting to see the COVID nurses, meaning the COVID nursing students, meaning the nursing students that really just went into nursing because they saw all of those big bucks during COVID. Nurses that are getting into the profession for the opportunity other than the work or the art of nursing. What really made me see this was back when my mom was in the hospital last year with her big health scare. And it had been a while since I had really been on the other side of the healthcare system, receiving like services from nurses and doctors versus giving those services. And my mom was in, like I said, you guys, those of you guys who know, I grew up in a small town. So the hospital where my mom was hospitalized is where I did my LPN clinicals, is where I did my RN clinicals. And so I'm very well known at that hospital. And I even encountered some nurses that followed me on Instagram, followed my YouTube page. So, but what I was struck with is the lack of compassion that these nurses showed my mom while she was in the hospital. Now, mind you, I stayed with my mom until she was discharged. I was there, I slept there, and you know how word travels. Those of you nurses who know, like if there's a nurse in the family, you know, that is there, they're going to let you up like, hey, her son's a nurse or her daughter's a nurse and she's in there with her. So y'all know how we do. But granted that I was in the room, people typically, I mean, back in the day, people typically kind of went out of their way to really, you know, take care of my mom or my dad, whoever was in the hospital. But it's just really, the care was really mediocre. It was very laissez-faire, if I have to say so. And it was just very task-oriented. There was no compassion. And thankfully, I was there with my mom. I did mostly everything for her. Only thing the nurses really did was kind of bring her medicine, hang her IV, stuff like that. But as far as her ADL care, her bathing, her getting her cleaned up, I did all that because this is my mama, right? But it's just the compassion was just not there. And when I made a video a while ago saying that nursing is a true calling and it's not a job, it's not a career, because like I always say, the word nurse is a noun and a verb. And when you nurse somebody, you have to do it with a certain amount of compassion, empathy. There's a lot of nuance to nursing. And I think that is what's being missed with these newer nurses. And I can see that. And also, even with my jobs that I'm working now, some of the things that would not have went when I was a new nurse is just common practice now. You know, just the way we talk, some of the nurses talk to the patients, some of the way the nurses talk to the family members. Granted, you know, family members and patients are different. Now, don't get it twisted. I'm still bedside nursing. I don't care about, I know I got my master's, but I'm still at that bedside. So I know that patients and family members hit different. Okay, so I know this is not lost upon me that patients and families can act like boo-boo the fool. But at the end of the day, I feel like nurses should be held to a higher standard. Now, I'm still like, I meet energy. Don't get it twisted. Like, you know, I'm very, as a matter, like now you have to, as a nurse, you really have to be as a matter of fact with patients and families nowadays, because they will completely run you ragged. And I do see the other side of it. Nurses are tired. Nurses are burnt out. Nurses are being asked to do things that is not their jobs. You know, nurses are expected to be everything to everybody and then go home and be everything to everybody. So I understand that sometimes the burnout can't inhibit the compassion, but one thing that I do before I start my shift is, first thing I think to myself is like, lead with love. Lead with love. Lead with love. And a huge thing too, I believe that the universe is a motherfucker. And being that my mom is, my parents are older and they're starting to have health challenges that require them to be into the healthcare system a lot more. I just pray, or I hope, that their nurses, their healthcare professionals, their phlebotomists, their CNAs, their doctors, their therapists will have the same compassion towards them that I've given to my patients. And my boyfriend's mom, my mother-in-law, she always says, you going in to take care of God's senior children? And that's what I do. So nurses, I understand that holding on to compassion in this day and age of nursing is so difficult. It is so almost implausible sometimes. But I just implore you all to lead with love. Lead with love as best you can, as much as you can. And also meet yourself where you are every day. And I understand that some days take a lot more than others, but try to lead with love, because I just pray when it is my turn, or when it's my time to be on the other side of the healthcare system, I want my nurse, my doctor, my CNA, my therapist, my phlebotomist to treat me warmly and to treat me with the compassion that I deserve, because I have spent 17 years, you guys, I have been in nursing for 17 years. And I hope that they treat me with the same compassion, the same, I'm losing my words, y'all. Just treat me the way I've treated my patients over the last 17 years. And you guys, that's it, you guys. I'm not going to drag this video out. I just wanted to talk to you guys before 2024 left. Follow me on Instagram if you have not already done so, at Adam Deshawn. Also, comment below on topics that y'all want me to discuss, y'all. I have just been so uninspired these last few months on what to talk about. Comment below if there's something that you want me to discuss. But please go back and look at my videos before you comment, because I probably already commented. I probably already made a video about this. But like I said, follow me on Instagram. Subscribe to this channel. Hit that notification bell so you guys can get notified when I upload shorts and videos. But until then, I will see you guys in the next one. Happy nursing. Bye.